Within each of us, there is an unexplored system that unlocks our body's ability to heal itself. Although only recently discovered, it has kept bodies in balance for millennia. I believe that if I can find the right combination, it might just save my life. My name is Michelle, and I have a crazy story to share. If I hadn't lived it myself, I probably wouldn't believe it, but I promise you it's all true. I have an incurable cancer, and I'm treating myself with a substance that's been banned around the world for 80 years. Maybe you've guessed, I'm treating my cancer with cannabis, and this is my story. We live in California where medical marijuana is legal. I happen to live next to a neighbor who's a retired GP. His retirement project is studying cannabinoids, and he's very interested in the medicine that's hidden in this amazing plant.
Michelle and Bruce had spent a year in England, and when Michelle returned, we heard that she had been diagnosed with ovarian cancer. I suggested perhaps that cannabis would help her get some relief from anxiety and maybe help her sleep. I pointed out that there have been a number of cases where cannabis has been shown, or at least has been suspected to be effective in controlling some of the genitourinary type cancers.
If Bill hadn't suggested that I try it, initially just for sleep and to relieve what I call disease anxiety, I probably never would have started. And if I hadn't taken the lower doses and seen some changes in my tumor growth, I never would have tried the really high dose regimen and seen my tumor shrink. By using the CA-125 blood tests that I had every 3 weeks during my remission, I was able to change my cannabis dosing in between each blood work and get a good sense of how my tumor was responding to the different cannabinoid treatments. A pretty amazing pattern emerged. While I was on a low THC dose that the neighbors made for me, my number was going up just 1 and 2 points every 3 weeks, pretty consistently. And then we had an international trip to the Galapagos. So I call this my Galapagos experiment. No treatment for 3 weeks because it's illegal to travel with it. And my number shot up 8 points. And my oncologist was pretty shocked. And then I started a high THC formula, and I slowly worked my way up to 60 milligrams. And my number fell 40% in 3 weeks, which is really remarkable. So I kept doing that for another 2 weeks before surgery, and it fell again. So it fell 50% on no other treatment. So I feel like there's something in here. I'm really a data-driven person, and when I look at this, I feel like I need to figure this out and figure out how to keep my numbers stable, because Western medicine doesn't have a good option for me. I'm just going to have to do my own science, because I think that I don't have time to wait for real clinical trials. I dove into the latest peer-reviewed journals to find the preclinical data abundant and clear. Cannabis has powerful and diverse anti-tumor properties. For the past 8 months, I've been reading all of the papers and the latest findings from some amazing labs around the world that are working on this.